Today we're going to talk about calcium deficiency disease, also known as hypocalcemia. Hypocalcemia can occur when the body doesn't have enough calcium in the bones, where 99% of it is stored. Calcium is the most abundant mineral in our bodies, so it plays a pretty big role, which we'll talk about later on. Hypocalcemia can be caused by many reasons. Aging is one of the largest influences of hypocalcemia because bones thin out as we age and more calcium is needed to increase bone mass to support the body. This lack of new bone formation is called osteoporosis. Women going through menopause are also at risk to osteoporosis from hypocalcemia because the estrogen hormone levels in the body decline and causes bones to thin faster. Hypoparathyroidism is a deficiency of the parathyroid hormone, which controls the calcium levels in the blood. When there is less of the hormone, it can lead to hypocalcemia. The parathyroid gland is located behind the thyroid gland in the neck. Malabsorption is yet another contributor to hypocalcemia because the body can't absorb the nutrients and vitamins, which include calcium from the food eaten. Premature babies are susceptible as well, which can occur due to diabetes from the mother, low oxygen periods, infection, and stress caused by serious illness. One of the simplest ways to become hypocalcemic is to not consume enough calcium, which often happens in cases of malnutrition. Now that we know how we can get hypocalcemia, you're probably wondering, why is it important, and what happens if I'm calcium deficient? First off, calcium is the most abundant mineral in our body, and it helps build strong bones and aids in heart, nervous, and muscle function. It also regulates blood clotting and blood pressure. If that wasn't important enough, it also prevents cancers in the digestive tract. During the earlier stages of hypocalcemia, there are usually no symptoms except for white spots on the nails that look like this image here, and are pretty common to find. However, as the deficiency develops into later stages, memory loss, muscle spasms and cramps, numbness or tingling in the hands and feet and face, depression, and hallucinations can occur. Now you might be thinking, well, how can I prevent this from happening to me? Ultimately, the best way to ensure that we have enough calcium is to have an intake of enough calcium, because our bodies don't produce it on their own. Dairy products, broccoli, kale, canned fish with bones, calcium-fortified soy products, fruit juices, and cereals are all foods that are high in calcium, and incorporating these into your diet can help ensure sufficient calcium levels in your body. Calcium supplements can be prescribed as well. However, they can be constipating, so it's usually recommended that they be taken with magnesium supplements. In patients that suffer from malabsorption, an adequate intake of vitamin D is recommended because vitamin D helps the body absorb calcium. Milk, as we know, is a great source of calcium, and consumption is an easy and efficient way to get the recommended daily dose at 3 glasses of milk per day. However, approximately 65% of the population is lactose intolerant, so they tend to avoid dairy products, which includes milk. People with the intolerance must find other means to consume calcium. Vegans are also faced with this issue because cow's milk is an animal byproduct, which is generally restricted by the vegan diet. I hope you found this video informative, and remember, drink milk.